for his insatiable desires on behalf of the people of Essex County when he says putting Essex first has been his theme throughout his career as the county executive. I can tell you that is such a truism. I had the county executive, I guess it was, I don't know, a couple of presidential elections ago. He was at the convention with me. We were having dinner, and somebody came by and said hello, and after that person left, he goes, "Who is that?" I said, "That's the president of Citibank." He goes, "Do you think they'd be interested in Turtleback Zoo?" This is what I deal with all the time. So, but I love him because he's just a great public servant. Dr. Bonney, thank you for that introduction, and as well to be joined by your colleagues, and of course my good friend and partner in the United States Senate, Senator Booker. You know, we work together so hermetically to ensure that there is no space open for us not to maximize New Jersey's capabilities and opportunities. And so we worked incredibly hard now that we once again brought back the possibility to earmark, which is basically directed spending for critical projects in New Jersey. And since we each get to put in, we work together to make sure that we maximize for the state, working with our delegation, working with Congressman Payne, the most possible for the greatest benefits for the people of New Jersey. And you couldn't do that if you didn't have one fighting colleague who knows the state, certainly knows Newark probably is better than anybody else, having been its former incredible mayor, and just a tremendous advocate when he's speaking to our colleagues. So, Corey, thank you for all of your work and for all of the efforts together. And certainly be standing here with the nurses, doctors, and staff of one of our state's premier teaching hospitals. As I said, Dr. Bonney, thank you for hosting us outside of your emergency room, which we know for the past 2 years has been the site of countless moments of grief, exhaustion, and valor as your staff worked tirelessly on the front lines of the COVID-19 pandemic. I also want to recognize our union leaders here today, specifically Debbie White, president of HPAE, who is a steadfast advocate for our nurses who are the embodiment of skill, care, and compassion. We're going to be hearing from one of those nurses, Bonita Herndon, about her frontline experience in the hospital's emergency room. I recently, for the first time in my life, had to undergo an operation, and I can tell you, nurses make all the difference in the world. So thank you to all our nurses. I want to take a moment to thank each and every healthcare worker here at University Hospital and across the state and the nation for their dedication, commitment, and bravery over these last 2 years. You're all heroes that we owe a debt of gratitude to. And before I get to what we're actually here about today, I want to congratulate Dr. Elnahal, first of all, for his leadership here at University Medical Center, and for his nomination last week by the Biden administration to be the Undersecretary for Health for the Veterans Health Administration of the Department of Veterans Affairs. It's going to make a big difference for our veterans in this country. And Senator Booker and I know he will make a meaningful impact on the advancement of health care for our nation's veterans, just like he has done here at University Hospital throughout his career. Congratulations, Doc. Last week, Congress passed a federal spending plan that includes over $232 million for New Jersey communities and families to help grow jobs, lower costs, and tackle some of the most pressing issues that we have, such as health care. This included approximately $12 million for New Jersey hospitals and community health centers. We know how difficult the past 2 years have been and the incredible strain the COVID-19 pandemic has had on our healthcare system. Since March of 2020, our New Jersey hospitals have seen more than 64,000 COVID patients. However, the life-saving efforts that our hospital made during the pandemic were expensive, as resources were diverted to COVID care and away from other advancements and needed upgrades. The funding we are announcing today is critical in helping hospitals and health centers make the critical upgrades needed to meet our community's needs today and into the future. New Jersey is home to many premier medical institutions, and funding like this will ensure they continue to serve as beacons of quality health care. But I know myself and my colleagues here were all disappointed that the additional COVID relief funding the country so desperately needs was not included in the funding bill because of Republican demands. But we won't stop working to convince our colleagues across the aisle to work with us on a separate funding measure to ensure that New Jerseyans and all Americans are able to access life-saving COVID-19 treatments, tests, and vaccines. We're maybe in another stage of the virus, and we certainly welcome that. But we also all know that the virus won't just disappear. And to manage current and future cases, we're going to need a large enough stockpile of treatments, vaccines, and supplies to keep transmission low and to respond immediately if we see a surge. We need this funding to keep schools open and our economy recovering and having that recovery move forward. And Corey and I will continue to push in Washington to get this done. Nonetheless, County Executive, today is a big day. We're pleased to announce that University Hospital has been awarded $3.87 million in federal funding to create right behind us a state-of-the-art trauma operating room. A trauma operating room is an essential, as you heard Dr. Bonney say, an essential life-saving resource that helps improve patient outcomes by controlling bleeding within the golden hour of a critical injury, made more difficult by the time it takes EMS to transport a patient to the hospital. Data shows that 10% more children with chest or penetrating trauma will survive in a center with a trauma OR. This project will save lives in Newark and Essex County. It will also give our Rutgers, New Jersey medical school students the added experience and knowledge of working in a trauma OR that when they graduate, they'll bring to trauma centers across New Jersey. We're looking forward to returning here to University Hospital for the ribbon cutting of that new trauma operating room. $12 million in funding we secured will also fund projects at 9 other hospitals or community health centers. It will fund facility improvements and upgrades. It will fund the purchase of an advanced cardiac MRI machine to create detailed pictures of the heart without using radiation. It will pay for the renovation of examination rooms and the purchase of medical equipment to expand and improve access to care. And these are just some of the projects that will get off the ground because of the funding we were able to secure for New Jersey. Finally, today's announcement comes on the heels of a one-year anniversary earlier this month of the enactment of the American Rescue Plan, which provided millions of dollars of federal funding to chart our path out of the pandemic. For example, our 24 federally qualified community health centers operating 135 sites statewide were awarded a combined of nearly $130 million in funding from the American Rescue Plan last year to expand access to COVID-19 vaccines, treatment, and health services in the hardest hit, underserved, and vulnerable communities across New Jersey. We were proud to support this funding so we could get shots into people's arms and rebuild our economy. But I also know we need to do more to investigate the pandemic and ensure we are prepared should we be faced with another public health crisis. That's why last summer, right here at University Hospital, I unveiled my bipartisan National Coronavirus Commission Act, which would create an independent commission with a broad mandate to investigate, identify lessons learned, craft recommendations, and improve our nation's readiness for future public health emergencies. Never again must the United States of America be caught with its guard down in the face of a deadly and contagious virus. I'm proud to say that just last week, the Senate Health, Education, and Labor Committee introduced the Prevent Pandemics Act, which includes the key provisions modeled after my bipartisan National Coronavirus Commission Act and will allow us to prepare for any and all future public health crises. Before I turn over the microphone to Senator Book, I just want to take one last opportunity to thank all of our frontline healthcare workers who have heroically battled one of our nation's most uncertain eras. As masks come off and normalcy returns for many people in communities across New Jersey, it can be easy for some to forget what you've done and all that you've seen. But Corey and I will not forget. We promise to continue to fight in Washington to ensure you have the critical resources you need to keep all of our loved ones healthy and safe. And in that venture, I can't have a more powerful colleague than Senator Cory Booker.